Hey team, I'm excited to share this episode with you today. In today's show, we'll be clocking in with my friend Marissa, where we go in depth about what it's like being a nurse, how to get there, and her salary journey. This episode is extra special to me because before chatting with Marissa, I literally knew nothing about the hospital setting, and I have to give a huge shout out to all of the nurses out there. All right, let's jump in. Marissa, thanks for coming on to today's show.
Thanks for having me, Steve.
It's so cool talking to so many of my friends and family because we've actually known each other for quite a while now.
How long time?
2014 or 13, something like that.
I feel like it's been longer. Is it really only that?
Yeah, I think so. Because that's when Elizabeth and I graduated.
It's like over 10 years, Steve. Look at us.
I know. How did you think of, what'd you think of me when we first met?
Oh, God, we're getting into this.
We're jumping right in.
Wow. Well,
First impressions.
God, you were such a spaz.
Yeah.
But it was kind of like one of those, like, what are those? The things me and Lizzie's books we talk about all the times. Enemies to lovers, but not lovers. Like, it was like, I hated the crap out of you. Like, truly we're not a fan. But, like, now being able to grow with you and, like, seeing us become adults, like, the love and appreciation I have for you is huge. So, enemies to lovers in a familial way.
Yeah, but not the lover
yeah,
part.
not that.
Yeah, it's like the family way, but it's not kind of like the weird family
yeah.
way. Okay, all right. I don't know. All right, cool.
Can't even.
So a couple days ago, you had a test. What are you working on right now?
So I'm in my NP program.
Oh, okay.
And
NP.
currently I'm in my advanced pharmacology class. So
Advanced pharmacology. What is that?
So like the study of drugs and pharmacokinetics and like how a drug is processed through our body and how the body then responds to it and how we then metabolize and excrete different drugs.
Oh, wait, you said pharmacology?
Yeah.
Okay, I think I just learned about this. Like, I was talking to a friend who is a pharmacist because I was interested in, like, possibly manufacturing insulin. And so I was talking to him, and I was like,
Big
bro,
market.
is that how you do this? And he's like, oh, no, that's a pharmacologist. So is that, like, the person who, like, studies the drug and the compounds of it?
I would assume, yeah, it would probably go more into, like, the actual, like, there's all these crazy big terms like pharmacodynamics, pharmacokinetics, and like I said, it's specifically the study of like the actual compound of the drug and like when it comes into our body system, like how does our body then change the drug itself, and then how does the drug then affect our body? It's really like nitty gritty, and like I've learned they only give us like short windows of like sections, so I've learned like little bits on certain drugs and like how our bodies handle them.
Gotcha. How'd you do on the test?
I did okay, but to be honest, I didn't have as much study time as I had like wanted to. I actually rescheduled it earlier than, so I know I told you I was taking it on Monday, and I actually rescheduled it 2 days earlier because I just was tired of studying.
Like, why wait?
I had fun things I wanted to go do, and I was like, I'm just gonna.
I like that better.
I was like, I want to just get this done, and like I know what I know now. I don't see how cramming for 2 more days is really gonna like benefit me, so I just took it. But I did well. I'm not as good as I'd wanted, but it's still
a pass is a pass.
It was a high B.
Oh, okay.
So it was good.
The way that I was thinking about it was like all or nothing.
No,
okay, so it's like the normal scale.
Normal scale, but my school kind of like tweaks it a little bit. I think an A now is considered like a 93 and up. It's not like a 90 and up, like, but whatever.
Okay, gotcha.
I got a good grade and I passed. That's all I care about.
I've been really looking forward to this conversation actually because I don't know if you know this, but I feel like, I don't know if it's an Asian thing or my family thing, but we don't like super believe in the hospital. So I don't understand anything medical related. And so when people, like when I get sick, I'm like, dude, I don't know. Like, bro, it's like, get me a bowl of pho and some like Sprite, you know? And so when people are like, oh no, you go to the hospital and you get a thing, and I'm like, I don't even know what those words mean. Like, yeah. So kind of really looking forward to this.
Sure.
So,
open book.
Okay, so you're a nurse, but like, I feel like there's a lot of different kinds of nurses. Can you describe your title?
So I am a registered nurse.
Okay.
I work in a hospital. I work in the ICU, which is the intensive care unit. So I take care of people kind of like at their sickest of the sick. It's kind of like your last resort. We talk about it like as upgrading in a hospital. Like there's different levels. ICU is probably like the highest tier. It's like your last stop. Like either we can fix you or we cannot fix you.
Okay, ICU is the last stop. And so that's different than ER.
I say that in a way of like just to like show the different levels of care. Like we're not necessarily the last stop, but like
Mm-hmm.
if you heal and you get better, like you get to go to the other floors and like continue on your healing journey. But like the ICU is like if you're sick and you continue to get sick and sick and sick, that's kind of like your last spot of like resources of like we can do the most intense kind of care. Hence the term intensive care unit.
Okay. What other like types of nursing is there? Maybe specifically in a hospital setting?
It's honestly crazy the different like variety of nurses there really are in a hospital because there's so many different units that I think sometimes people don't even realize is run by nurses and other medical staff as well. I mean, usually there's like a general like med surg floor, medical surgical floor. So like if you're a post-surgical patient, whatever surgery it may be, you usually can go out to like a medical surgical unit where you're usually on those units, you're pretty ambulatory, but you're usually dealing with like a lot of like pain, post-op complications and like things like that. Then there's usually the progressive care unit or like some hospitals call it like a telemetry unit. Those are more of like your cardiac patients that need to wear like a monitor that monitors their heart because they have some kind of like cardiac condition or some kind of condition that needs a little bit higher monitoring. Then there's the ICU, which is where I am, where I said we do a little bit more of like that higher skill to maintain people's lives, essentially. But then there's like other departments where there's like interventional radiology, there's endoscopy, there's emergency department, there's outpatient surgery,
Okay.
OR nurses, operating room nurses. There's just like nurses everywhere.
Gotcha. Listening to you, you've mentioned in the past something about like bedside. What does that mean?
So there's like bedside nursing versus like ambulatory nursing. Bedside being like you're a patient that's admitted into the hospital for any length of time, and that nurse that's taking care of you is bedside. We are at the patient's bedside taking care of them. Whereas like ambulatory nurses could be like working in the clinic where a patient comes in to maybe have their scheduled chemotherapy administered to them, or like they have some kind of like lab draw they need to come in for. Those are kind of like the two ambulatory sides to it.
Okay.
But there's even in those like departments, it can split off into just a million different kinds of nursing.
Gotcha.
A whole like it's hard for me to even pinpoint all the different specialties because there's just unlimited.
What nursing title have you had, or like what departments have you been a part of?
So when I was a new graduate nurse, I started on a progressive care unit, which was like a unit that is not as high as ICU, but it's maybe like slightly higher than med-surg in regards to like maybe acuity. We would deal with a lot of patients like that. This is the unit I was saying earlier that had like we monitor their heart rhythms continuously with monitors, and so a lot of these patients.
That's with the finger thing.
Well, that's pulse ox, but yes, a lot of
Okay.
our patients would have continuous pulse ox too, because they just required a little bit closer of monitoring than like the general med surg floor. Not to say that like that any nurses are better than any. I want to make that very clear. Like when I talk about this like hierarchy, I'm not talking like hierarchy as in like nursing, because I think that we're all essential in like our different specialties. It's just more of like the level of care that we're able to provide on that
It's
department.
level of care,
Yes.
not like. Okay, I'm tracking what you're saying.
Yes.
Okay, gotcha. Level of care.
Yeah, that's the perfect term for it. It's just the level of care that patient is requiring at that time. So I started on that unit, a progressive care unit, and I did that for, I think it was like 3.5, 4 years. I had gotten deep into it where I was doing like charge nursing on my unit. And
What is that?
I was that nurse that was kind of like in charge of that unit. So the
Okay.
nurses would come in that morning. I had created their assignments before they got there.
Mm.
I would pass out the assignments to them and let them know, hey, like Steve, you're going to have patients 1 through 5 today. And then sometimes I would also take patients as well as being charged. But then I would work with like the house supervisor, the emergency department, the like OR staff, like PACU, to make sure if they were having patients come in, like I could allocate beds for those patients. But I got to a point where I was kind of like, not to say bored, but like I was bored. I needed to learn more. I was like, I've reached my cap at this
Yeah.
point. I need more. And that's when I had applied for ICU. Now I've been in ICU for, I don't know, 6 years.
Okay.
Yeah,
Wow.
6 years.
So you've been a nurse for like 9, 10 years now.
10 years this August.
Wait, congrats.
Yeah,
That's
no, it's
crazy.
freaking me out, honestly.
Yeah.
It's kind of stressful.
Like 2 buckets then. Progressive nurse. Oh, progressive
Yeah, you can see PCU, progressive care.
progressive care, and then ICU,
Yeah.
intensive care unit.
Yes.
Oh,
Look at you.
we're learning
Look at
fast.
you.
We're learning fast. Okay, gotcha. That's pretty cool. Are these like gunshot wound people, or is that like, or is that like ER stuff?
That was
or...
like my last job. So my last job I did trauma neuro ICU.
Okay, yeah. Okay, you mentioned
I had
trauma. So what does that
specialized.
mean?
So I at that point was like in a specialized ICU. So we would receive patients, again, wide variety. Traumas would be gunshots, stabbings.
Jesus.
I know.
Okay,
It gets
cool.
heavy really fast.
Yeah, it's like trauma. It's like legit, like bad car
car
crash.
accidents. Yeah.
But like specifically, like it has to. So you said like something about quality, not quality of care, but like to me, I'm viewing it as like the intensity, and so trauma feels like it's very intense.
It can be. Yeah.
And so that's a subsection of intensive care unit.
Yes. So like ICUs, there's a vast majority or a vast number of ICUs you can go to because you can specialize into different ones. Neuro being one of its own. Usually mine was combo neurotrauma, but then there's medical ICU, which is like patients that suffer from, I hate to say like more common like medical diagnosis like a COPD exacerbation or pneumonia. And then there's like a surgical ICU. There's cardiovascular ICU. There's a ton. Those are usually like your big contenders though.
Okay, I'm tracking. Were all of these like at different hospitals, or does every hospital have all of these units?
No. So where I started in the ICU, we had a MICU. So that would be the medical ICU. We had a trauma neuro ICU. And then we had a small CV ICU. Whereas like now where I work, it's one ICU, but we have 3 different specialties in our one ICU. We don't categorize them separately. So the nurses that work in my current unit are required to be experts in all of those specialties. Whereas at my last hospital, you were more like specialized in one specifically, usually.
And in that scenario, that was like trauma.
Yes.
Oh, okay. Gotcha.
And that's like where I had started there. But a lot of the times you float until you get pretty exposed to like the different patient populations.
So with different patient populations, do you need different certifications or anything, or is it just having the registered nurse title? Is that all you need?
You don't necessarily have to have special like certifications to get there, but once you're there, there can be like extra certification you can get to like advance your education in that specialty. So while I was in the neurotrauma ICU, I did end up getting I forgot what it stands for. It was like some kind of trauma certification. I went under like a 2-day, 8-hour course. It might've been longer, honestly, to like specialize further in like the trauma process when a patient would come in from the emergency department and like the exact process of how we run them down head to toe and figure out their injuries and the diagnosis and treatment. Whereas like in other departments, you can get specialized in other treatments. Like now where I'm at, I am required to take care of cardiothoracic like surgical patients, and you learn different like not certifications, but like skills in each department. So there's many devices now that I've had to learn because I'm now required to take care of those patients.
Okay, gotcha. So being a registered nurse, what does that mean? Did you have to go to school for that? Or
no, I just went in from the street.
Yeah, just hire on anybody.
I did. I went to school.
Okay.
I went to
Is that just like undergrad?
kind of, yeah. So I did like it's all. I went to Grand Canyon University, and they kind of like just put it all together in 4 years. So in 4 years, I do my like undergrad courses, and then I take my like RN courses, and that's just like my 4-year undergrad program. I get my RN, and at that point, then you take your NCLEX certification. And boom, you got your number, you got your RN number, and you're a big bad registered nurse. There's different kinds of like education because you can have like an associate's degree RN.
Okay.
Like I think they're just LPNs, and then you have like your registered nurse with your bachelor's, BSN, and then you can go further from there. But most hospitals around the valley, are requiring bachelor's degree. So your 4-year programs.
So LRNs?
LPN. I think that's an
LPNs?
associate's degree.
Okay.
And you still can work throughout the valley at different locations. A lot of them are more like, I think, SNFs or rehabs, but some hospital systems will still hire LPNs.
Okay, gotcha. Yeah, because I've been talking to some people and they were saying that they are doing an accelerated program.
Hmm.
And so, yeah, it was like, I don't know, 18 months to 2 years or something like that. And I was like, oh, wow, that's quite quick.
A lot of schools I think now are offering that because I get a lot of students that rotate in and they're taking these like crazy wild accelerated programs. Well, they'll go from like I think having like an undergrad and something else to
Oh,
then getting a master's degree even. So like I have a student now that's with me for the next like I think like 2 months, and she's in this accelerated program and she'll end up with a master's at the end of it.
wow, that's incredible.
Yeah.
Can you describe your schooling experience? Like, did you have to do any rotations or anything?
So in my undergrad, yeah, like once I finished my like prerequisite classes of like anatomy, physiology, chemistry, those like basic science classes and stuff, and you get more into like your nursing classes, they're like blocks. So you'll have like your first block, second block, and so on, and you will have clinical rotations in each block. So I think like my first rotation was. I think it was like my intro to geriatric nursing. I think I did clinicals in a SNF, which is like a skilled nursing facility,
Okay.
which is not for the faint of heart. Those nurses are warriors and get put through the ringer. Then usually after that, you go to like the hospitals. You'll have like adults, like med surge. You'll have a pediatric rotation. You'll have a OB rotations, like going to see like C-sections, delivering babies. And then you kind of go back into adults and critical care at that point. So then you have like, you get to go to the ICU at that point. And then you graduate and
Pick.
you kind of at that point you kind of have to figure out like where do I want to go from here. Most nurses always want to go into labor and delivery. It's usually like
Mm,
every single one you talk to wants to go into labor and delivery.
okay.
I was one of those nurses, truthfully.
But you didn't pursue that.
No, I during my interview process, they ask like what you want to do, and I was like, I really want labor and delivery, but I want to learn my skills. I'm gonna go to the floor for a bit and like get my skills, and then I'll just transfer in.
Oh.
And so I gave up going to labor and delivery because I didn't want to do night shift, and went to the floor and fell in love with old people. Truthfully,
Wait, old people?
truly, I it's so strange. Like I was dead set on being a labor and delivery nurse. That's all I wanted to do was deliver babies. And my first job was in Sun City, and I was taking care of old people, like on the reg. Our average patient age was like 75.
And this is in the PCU.
Yeah, it was. I worked on a specific PCU floor that was dedicated to congestive heart failure patients.
Okay.
And so most of our patients were, like I said, 75 and older. It was like rare. I would have a patient in their 60s. Like that was rare for me. And I just love. I
You're
loved
like
it.
a youngin came in today.
It was
Young
so
spirit or
it's
whatever.
strange, dude. I transferred to a hospital out here where we live,
Mhm.
and I went to a PCU again. But like the patients were like in their 30s.
Yeah, like
and I'm like, I don't know how to do this.
yeah.
Like, what
I've
do you
only
mean you don't
talked
have
to old people.
grandchildren? Like,
Yeah.
we're supposed to tell me about your Like, it was just so
Right.
weird. But yeah, I just fell in love with old people, and I was like, I don't want to go work with babies. I love this.
Yeah.
This is fun.
Okay, so you ended up going in the complete opposite spectrum.
Yeah, huge. Like I never wanted to work in the ICU. I'll be honest. Even as a progressive care unit, I thought ICU nurses were total assholes.
Mm,
I was very wrong because I love it. I love it. I think ICU nurses are great.
same. Big fan. Yeah.
Again, I love all nursing, but
Right.
like it's just so strange to like. Sometimes I think we pigeonhole ourselves and I'm thinking you're like only want to go into one specialty
Mhm.
when there are so many different specialties you can go into and like just try out and see what fits.
So with your schooling rotations, maybe
Clinicals, yeah.
your clinicals, did any of your clinicals like translate into you getting a job? Like, did you go to a hospital that you ended up working at, or is that not how that works?
You
for
can.
nursing?
You definitely can. I personally did not. I mean, I work now at a place I did have clinicals, but it is like not in relation whatsoever to me having clinicals there. But I know a lot of people, again, because I get students on my unit now, and I know a lot of them through their clinical rotations, they have been able to secure jobs on the units that they've been on. But I just personally didn't go down that route.
Okay,
It is
I see.
possible. You can network for sure. I mean, nursing is in shortage all the time, so.
Gotcha. Yeah, I think that's what happened to Elizabeth was she did some rotations, or I guess that's how she called it. And I think she now works for maybe the last rotation that she was at. So,
Yeah, I remember her saying that.
mhm.
And they hired her right out of school. Right?
Yeah, exactly. Okay, cool. So you're pretty well seasoned, 10 years now. Do you have like extra responsibilities? Like what's your day to day like? Are you a charge nurse or?
At my current job, no,
Oh, okay.
no. I am like just a bedside nurse at this point. Like there are a couple responsibilities that you could like take on at my current place of work, but I just haven't really gone there yet. Truthfully, I'm kind of going down the school route again. So,
Okay.
but like
Right.
there are different like skills that you can take on. Like from where I started at my current job to like where I'm at now, like I've taken on multiple new skills and like had to go through like further education just in my current role. So like it depends on the day. I could have different therapies that are super intense and exciting, but
Yeah. Something that I think is kind of interesting is the schedule for medical professionals, or maybe specifically like nurses, or at least my understanding is you don't really work normal, what is that, 8 hour
like a
days?
9 to 5.
Yeah, you don't do 9 to 5s, but you do like 12s.
Yeah. So typical nursing schedule would be 3 12s, 3 12.5 hour shifts. And what's really cool about our job is you get to design your schedule for the most part. Your managers will move you around sometimes, which is a pain in the ass. But for the most part, you pick 3 days a week and that's it.
Hmm.
You can pick up more if you choose to, but it's you start at 7 a.m., you leave at 7:30, 8 o'clock.
Is that pretty typical, like 7 a.m. to 7 to 8?
Yeah, for most of the hospitals in the valley.
I
Yes.
guess that makes
7 to
sense.
7:30.
So then there's like a night shift, and then that's the
Yeah.
other 12.
Yeah. I mean, it depends on how like crappy of a day you have. Sometimes you're there till 9, 9:30.
Hmm.
But no, typically 7 to 7:30.
Do you also get overtime?
Yes, you can.
Mm.
Well, usually there's overtime. Like the thing with nursing is we call it the flu season, and with the snowbirds coming down to Arizona. So usually the summers are slow. You'll have opportunity for cancel, which is great. It sounds terrible. Getting canceled is a lovely experience.
You're like, yes, I will take the day off.
I hate when people say like, "Well, you only work 3 days a week." Like, you have no idea what I do in those 3 days. Like, having one of those days canceled is a lovely experience.
Yeah.
It's like one extra day for me to lounge on the couch. But in the like winter seasons when the snowbirds are here from whatever state they're coming to stay from,
Yep.
like the flu is in like full force. The winter seasons are brutal. And we're in that right now where I work, and there's overtime almost every single day. Every day.
Yeah. Snowbirds coming in, coughing around, like
Driving like idiots on this freeway.
Yeah,
Don't get me wrong, I love
literally.
you snowbirds, but like maybe go the speed limit.
I know, literally. Yeah, don't swerve into me. Like, yeah, 2 hands on the wheel, please, Susan,
Yeah.
please. I don't. It's Karen's. That's so funny. Yeah, the 12-hour days is so interesting because you I don't know, like for me, I always worked 9 to 5.
Yeah.
And so I never thought about the 12s. But so you really do like 36 hours
Yeah.
unless you pick up more?
Technically 36, 38 with like how late we're staying. But yeah, it's usually 36 and it's lovely. Honestly, like it blows my mind. People working 9 to 5. Like I've been offered jobs a couple times where they're like 410s or like, oh, Marissa, you'll have to be here Monday through Friday, 8 to 5. And I'm like, I don't think I could do it.
Yeah.
I don't think I could do
I'd
it.
rather work more hours and have more days off. That's
It's
easy.
so nice with
Yeah.
like scheduling your own like personal stuff going on. Like it's really nice.
Do you have like blackout days? Like, do you get like, I'd be like, dude, I'm taking every weekend off type thing. Or do some force you to take weekends?
There are required weekends.
Okay,
So
I
like
see.
where I work, you have to work like, so our schedule period's open and they're 4-week windows and you have to work 3 weekend shifts in a 4-week period. So whether that be like a Saturday, Sunday, and then a Sunday the next week, like you are required to pick up those weekends. Some places I've worked in the past have been like every other weekend you have to work. So it's pretty fixed in that sense, but you can build your schedule around that. And some people prefer to work weekends. And so getting a weekend off isn't necessarily hard because you can just trade with the people that want those shifts. But a lot of the times people don't want those shifts. So you end up getting stuck with them.
Gotcha. When you work, are you generally working by yourself or are you working on a team? And like, what is like the general stack of the team? Meaning like, are you working with other nurses or are you working with like, I guess a doctor and maybe somebody that is, or a nurse practitioner or a, maybe, I don't know who'd be below.
Just all the different people.
Yeah.
So in healthcare, there's such a wide variety of people that you come in contact with on a daily basis. So on a like I work, we call it the pods. So like on my pod, there would be like maybe 6, 7, 8 nurses. But then we usually would have like a physician. We'll have like the advanced practitioners, whether that be a nurse practitioner or a physician's assistant. We'll usually have, we're a teaching hospital where I work now. So you'll usually have like a couple residents roaming around. We have some techs. So like some nursing assistants that will help us. Physical therapy on a daily basis. I see physical therapy, occupational therapy, dietitians. It's endless, the people that are on our team that we come encounter with on a daily basis.
Oh, that's really cool. Yeah, from my experience, like, yeah, we do have like little pockets of other, I don't know, job skill or whatever it's called. But like in general, like I only work with engineers, but there are like other people, like there are, I don't know, product managers and schedulers and planners and all of these things. And I don't really interact with them too much, but it's really interesting to see you having so many different professionals to work with.
It's like constant. Like we have work phones and it's constant me calling someone, whether I'm calling respiratory therapist because I need help with my patient not oxygenating, or coordinating with physical therapy. Like, hey, you guys want to come at 9:30? Like I'm going to get my patient up to the chair. It'll be perfect. Like it's endless who I talk with in a 5-minute span, like constant.
Wait, did you just say you have a work phone?
Yeah.
Does that mean like you have on call or?
I mean, like the second I'm leaving work, it's off.
Oh,
like,
okay.
You won't get to call it.
Oh, okay.
But like some hospitals have like little like walkie-talkies almost that you like push a button, you say, hey, call Steve Thatch. Like you just push a button and it'll call him. Like where I work now, we have like actual little phones that you can like dial and get a hold of like your whole team just right there.
Because I think I've seen other people who are nurses say something about on-call rotations, and I'm like, so that's
it is a thing. It is a thing.
Oh, okay,
for me,
gotcha.
no. It depends on the department you're in. So if you want to go into like interventional radiology, which is like a little like subspecialty unit where they will do procedures, anything procedural is going to have on call. I don't know the requirements for on call. Every hospital is different, but there are many departments that will require on call. But you get the big money with on call positions though.
Oh, okay.
So usually I think you get like call pay just for like being at home. And then if you're called in, something like time and a half, I think.
Okay. Oh, coming in.
Mm-hmm.
Okay, nice.
Yeah. I have a lot of friends that do like procedural work.
Gotcha.
And they love it.
Yeah.
They'll take other people's call shifts because some people, again, don't want them.
They're like, it's easy
and they
cash.
want it because they're like, if I get called in, like I'm getting time and a half or double time sometimes, I think.
Oh, wow.
Yeah. I don't know.
Yeah.
I can't vouch, but like,
right.
I've heard.
Interesting.
Yeah.
You were telling me a little bit ago about how you did a little bit of travel work too. So were you an ICU travel nurse?
I was. I did one travel stint.
Okay. How was that?
It actually 3 years ago to the day I arrived at my travel assignment.
Let's go.
I actually was just looking at memories today on my phone. It was an experience, you know. It isn't for everyone. I personally had a hard time with it. I enjoyed getting to like leave my little Arizona bubble and getting to see like what healthcare was outside of like where I grew up as a nurse. But I'm very team based. I like to know who my team is and like
build that relationship.
Yeah, and so it was hard to go to a new hospital where I only knew me and my one friend, and the nurses that were there most of them were great, but a lot of them don't like travelers because we come in and do the same job they're doing essentially, but make a lot of money, more money than they are getting paid. I know that. And so a lot of them don't like travelers.
Gotcha.
So it was hard. I got treated very interestingly on that assignment. But you know, it's all good. That's why I'm there though.
Toxicity. And you're like, I thought we were here to support each other. The patient is who we're trying to help right now. It's not this.
Yeah, but it's a very dynamic relationship. Right. Nurses, higher ups, hospitals. Yeah.
So that was, I remember that being during COVID times. It wasn't during like the heat of it.
No, it was literally the tail end.
Okay.
Because like right after that contract, like they cut pay almost immediately.
And so I was going to ask, is travel nursing still as big? Because it felt like that was big back in the day.
It is a huge market still. I know, like, I still know people that will continuously go and travel all the time now. But like when it comes to like market of like pay, it's very different. It's not the same.
Okay.
COVID times were like a rarity.
Gotcha. Like literally
It was a rarity. Yeah. And I should have gone to do this long before.
And you're like churn it out while we're young, you know?
I should have gone long before. I stayed too long in that role I was in. But it was a cool experience. I would have done it again, but
How long was that contract?
they're usually short. They're usually only 3-month contracts, and
Okay.
then you can extend if the hospital offers it. Obviously, we've had travelers on my last jobs for like 6-9 months at a time, but yeah, it was just 3 months.
Okay. What was the biggest difference? Like you said, leaving your Arizona bubble, like besides the relationships, like seeing another hospital outside of Arizona, are there like different rules and things, or is it like every hospital is different in general?
Honestly, healthcare is healthcare to me. Like, for the most part, it's all the same. Like, the processes, for the most part, are all the same. The patient populations, usually kind of the same. It was cool to see because I at that point had only really worked for like one hospital system. So it was really cool to like be outside of that one hospital system and see how things were a little different, like in the day-to-day stuff, like how their charting was a little different, like what was required of them, like,
Mm,
oh, do you have to do a CHG bath every day here? Like, oh, cool, you don't? Great. Like, it was just like the little things, like just to get out of my nuances of that same hospital system I was with for like 7-8 years.
yeah. I'm a big fan of leaving and exploring as much as you can because I think experiencing different experiences is like how you grow as a person and in your professional career, you know?
Yeah, I think putting yourself in like sometimes situations that may be a little bit uncomfortable, that's where you're going to learn. So
Yeah.
it was a cool experience. I learned a lot about myself through that experience, truthfully. So it was cool.
What kind of patient is like, they're going to be a tough one to work with?
I don't know. There's so many. A
That
septic patient. I mean, I love a good septic patient. Like,
is that where like there's like poop in your
I'm
in
sure if that's the route. I mean, yeah, it's just when like any kind of like infection gets into your bloodstream,
Oh,
whether
it's infection.
whether that be like some bacteria from fecal matter that happens to get in there, whether
Oh, it's
because
not poop related.
there any kind of infection that
I
gets
didn't
into
know
your
that.
bloodstream
Okay.
can make you septic. Like, those patients are just, I love medical ICU patients. They're just so fun. They can flip so fast, and it's just a lot of like high adrenaline.
Hmm.
A lot of like fun drips you get to play with. Like, it's just a really fun. We get to put them on CRRT, that's like my favorite nursing skill.
What is that?
Continuous renal replacement therapy.
Oh, cool.
It's like think of like a dialysis, which I don't even know if you've ever seen that.
Something water in your kidneys.
You filter your kidneys through this dialysis machine. What essentially during like a standard dialysis treatment, they will remove like 3 liters of volume at a time. Where like a septic patient and their blood pressure is really shitty, they can't tolerate that volume pull. You'll put them on the CRRT where I can pull like little bits of volume every hour to
Mm.
try and like equal up to a larger volume because
Okay.
they can't tolerate that big flex of like fluid change.
Gotcha.
And like a
Oh yeah,
short
makes
period.
sense. Yeah, it's like okay, let's incrementally like
Exactly that. Give me a good septic patient. And I'm happy.
that's cool.
Yeah.
One of my favorite memories of when I broke my leg was that I had surgery and on my ankle and I woke up and my memory says like my eyes are closed. Like eyes are closed, but my brain turned on type shit. You know what I'm
Okay.
saying? And I like started getting out of the bed
Yeah.
and I remember the nurse going like, bruh, like
Yeah.
what are you doing? You need to lay back down. And then my response was like, I can't afford this. Is that like a topic that ever comes up about like
Like sedation.
no, I was actually talking about like people saying stuff about how like expensive things are.
Healthcare, not a whole
Or
lot.
is that kind of like not even in your realm? Like that's not a topic that comes
Because
up.
like I as the bedside nurse, like I don't know much about any kind of
Yeah.
billing. Like that's usually handled after. But yeah, we hear it. We hear it from patients on occasion complaining, which honestly I get it.
Hmm.
I'd probably be raging too. But there have been certain instances, I remember this was a couple years ago, where like my patient was delivered a bill from the hospital, like in his room while I was the weirdest thing.
Yeah.
So no, we don't usually encounter cost at all.
Okay, I think that makes sense
Thank
because
God.
yeah, literally
I
the
don't.
goal is to get better, not to oh yeah, and by the way, your heart is gonna you're
Yeah.
uh,
We don't need to focus on that
yeah,
right now,
exactly.
sir.
There's a
Like,
heart attack about to happen type
yeah,
shit.
no.
Good place to happen.
Yeah, that's where you want it to happen.
Yeah.
So,
Actually talking about stuff happening at the hospital, my grandma just fell down.
no.
She was at the hospital for some reason, maybe a normal checkup, and she like was walking up the stairs and fell backwards, smashed her head,
No.
and broke her arm. And she's good now. But
Thank God.
I mean, like, she still has a cast, so this was recent.
Oh.
But like, yeah, she was at the hospital. And so I was like, bro, like, I can't imagine her being at home because she can't drive.
Yeah.
She doesn't speak English.
Yeah, no.
She doesn't know how to use a phone.
It's
type
scary
shit,
getting
you know?
old. Yeah, it's scary. Like things like that happen all the time. Working trauma, we would get older adults that fall at home all the time, whether they be down for a period of time or they like are able to get help. Like happens a lot.
Does that life alert stuff like actually work? Because that makes sense. Because
I've seen them,
Okay.
but like I don't know. I mean, they must work, right?
I don't know if my grandma would know how to use it.
I
So,
mean, you just push it.
yeah, makes sense.
Like,
No, no,
does it call 911? Like,
yeah, I don't know.
do you talk to it? Like,
Yeah.
how does that work?
Yup, me. They're like, I don't speak Vietnamese.
They're like getting the translator. They're like, oh shit.
Yeah, literally.
What is this?
They're like, what language is this even?
Yeah, I wouldn't know.
That's so funny.
Maybe.
Could you describe a little bit more about like your other career opportunities that you can do as a nurse? So you have experience as a PCU and ICU nurse.
Like at my level with like a bachelor's degree or
Yeah, exactly. And or like continuing education because you're going into becoming a nurse practitioner, which is like a completely different level, right?
it is just like a different pathway of they're like nursing is so dynamic and like multifaceted. There are it's so hard because there are so many different things you can do with it. Like as a bachelor's degree nurse, like being inpatient, you can go to a multitude of different departments, like whether that be again med surg, PCU, IR, OR, ED. Like it's outrageous at a bachelor's degree what you can do in a hospital. Out of a hospital, you can do so many things as well. I'm not as familiar with those though, so like
Like
I probably
what?
can't
Like
go work at like a doctor's office or like an urgent care or like a clinic again. Like
or like
we
IV
know like
traveler.
yeah, like Taylor's wife now, she works in like a clinic and she does like IV draws for cancer patients and like administers chemo like outpatient wise. Like there's vast things you can do like beds that are like inpatient and outpatient at a bachelor's degree level. And then like if you get your master's degree, you could go into like being like a clinical expert. I'm not super familiar in that route, but like you specialize in like a certain area and you can like I think our clinical expert helps with like finding different tools for like our department and like institutes them to see if they're helpful and like finding us different items for our patients. You can become a manager, work your way up in like the managerial role, which I tried which is for a short period of time and ended up not loving that.
Because you have your master's degree in that, right?
I do, yeah. I got my master's in 2020.
Okay. Okay.
Yeah. Well, because I wanted to be a manager. That was like my goal. I wanted to be a manager and then become a director. But it just, like after I got my degree, I just kind of like changed routes, which is so appealing as a nurse because there's like a million different things you can do. So I ended up going to a different hospital and then getting my feet wet with some nurse practitioners that we worked with in the critical care department and diving on into NP school.
That's cool. How long is NP school?
Typically I think it's for like
and that's a master's.
Yeah, because there's different because you can get a master's like level NP or you can go the full whammy and get your doctorate. And and I think I don't remember how long. It's kind of confusing because I already have my master's, I got to cut basically and skip some of the education. I want to say because my program's 2-ish years. I want to say like a master's NP is 3, and I want to say a doctorate's 4 years.
Okay.
I want to say. So my program, I got to skip the first year because I already had my master's, and now I have 2 years basically of more schooling.
Gotcha. And so in terms of like the, I guess, hierarchy, is that where a specialized practitioner... Wait, is that what you said earlier?
What? Like a clinical nurse expert? That?
Yeah, you said some sort of practitioner.
A nurse practitioner?
Yeah, but you said another kind too. And so like I thought you made it like generic.
Oh.
Like you have your techs and then nurses.
Oh,
and then
yeah, I just blacked it out. An advanced practitioner. So whether
advanced.
that be like a PA versus an NP.
Okay, gotcha. Yeah. So are those on the same level? Like, is that how that structure would go?
Yeah. Like, I mean, different scopes of practice technically, just with like how they prescribe and like licensure. But like, essentially, yes, we are, like, kind of, I guess, at an equal with them, kind of.
Okay,
but it's just like a different scope, and like our education is very different.
Okay, I see. How much more schooling do you have left? Like, did you just start? Was this your first class?
I started in August of last year. So
Okay.
I'm in my second class right now. And I will graduate in August of next year.
Oh, okay. That's not
Yeah.
even that bad.
No.
Oh, 2 years.
Yeah.
Okay,
Not bad at
gotcha.
all.
Nice. That's gonna be really cool.
I'm stoked. It actually, like, doing this the second time around, like, nursing school was brutal. Like, it was brutal. There's, like, no other word for it. But, like, NP school, because of the experience that I have, is, like, so
Like shit
much.
makes sense now,
It
right? You're
does.
like,
It's
oh
like,
yeah, of
oh,
course you would
like,
do that, or
yeah.
of course that's what that
Yeah.
is.
It's hard, but it's like, oh, I have such a strong foundation already with my skills. I already know,
Hmm.
like, I can just build off of that. Whereas, like, when you're starting from square one as a
You're like,
little
dude, I don't
undergrad,
know.
you're like, what do you mean? What is cardiomyopathy? I've never heard of that before in my life. Like,
Yeah,
where
literally.
now I'm like, oh, okay, cool. Sounds great.
I think that makes sense. Yeah, when I was in school, I felt like I was always in survival mode, and
Hmm.
then once I got into industry, shit started making like sense because it's like, oh, okay, that's what those numbers meant, or that's what that equation meant. So I wonder that's probably the same,
Yeah, same
like,
concept.
same concept.
It's really cool to, like, see something on paper and then see it in real life and be like, oh, this makes total sense. Light bulb. Okay, this is how we take care of that.
Yeah.
Yeah.
That's pretty cool. Could you describe your salary progression over the course of your career?
Sure. I mean, it's all gonna be dependent on, like we talked about, it's gonna be dependent on, like, market, because, like, your hospital will match typically, like, market value of, like, what people are making in the area. So I'll tell you, like, when I started, I think I started at like $26 an hour,
Okay.
which, like, back then seemed like so much money. And then you start becoming an adult and realizing, oh shit, like, that's nothing. And then every year, usually your hospital systems will give you, like, a percentage of a raise.
Is that like
Depending,
cost of living type thing?
they'll do both. So they'll do what's called like a market match. So they'll do like a market match, and then they'll do like your yearly appraisal, where, like, based off of this, and this, you get this much like percentage of a raise. Where I work now, we get a market match and then usually like a fixed dollar amount. So I will say, like, where I work now pays a little bit more than where I used to work. So it just, over the years, it's just, like, slowly been like a couple more dollars here and there, here and there. And I've made my way up to, like, I want to say I'm like at 52 maybe.
Mhm.
I don't I'm really bad at, like, finance stuff. Like, truly, it's up here. Like,
Is 52 like $52 an hour or 52K?
I'm
A year?
hourly. So,
Oh,
like,
okay.
hourly, that's my wage, let's say.
Yeah, gotcha.
I think.
But so $52 an hour, but you get the opportunity to like work more or less because you're hourly. It's not like
Yes.
fixed on salary.
No, you can pick up as much as you want. If it's offered, you can pick up, like, so you could make drastic. I know people that make technically less hourly than I make, but probably make more than me in the year, like, long run, with the amount of overtime they pick up.
Yeah, and I was going to bring that up about the overtime or like the on call you were saying, like
On call is, like, wild. Like, truly, I have friends that do it, and they will say, like, oh, I got called in for yada yada shift, and then they'll, like, say how much money they made in their little, like, a 2-week period, because we get paid in 2-week increments. And I'm like, how did you do that? And they're
Yeah.
like, oh, on call.
just grinded it out.
Yeah, on call.
Gotcha. I think that is pretty cool because like for me as a salaried person, like I've had like, normal 9-hour days or 8-hour days, but then there were times where I was grinding out like 12+ hour days, and it's like, well, that's how it goes.
Yeah, there's my salary.
Yeah.
Yeah, I think about that sometimes too, because my boyfriend is, I think, you'll hear from him later. I think technically he's salary.
Oh.
But if he works overtime, I think they get, like, their hourly. So I'm like, I don't know if I like that, because some days you're there like 14, 15 hours. Like,
Exactly.
if it's a shitty day, like, I don't know. Hourly is a lovely thing.
I guess I don't know. I've never had it. I've never had it.
Yeah.
Yeah, actually at Northrop, I think what you're saying is exactly the same. It was like, for me, it was possible for me to get overtime, but I had to work. It required like special approval, and then along with that, I had to do like, so what is a normal week? 40 hours. It was like you had to break 100 hours for it to like unlock. And so
In 1 week?
Oh no, sorry.
Like a pay period.
Pay period.
Okay.
Yeah, so 50. So I would have to do 50 or 55 or 60 hours or whatever the math worked out, and then that would unlock, and that would just unlock 1 times X. Like it wasn't.
Sounds miserable.
It wasn't 1.5.
Yeah.
Yeah, exactly. So yeah, it's like, bruh, I don't need this. It's like,
Not for me.
you know what? I'll take the day off.
Not
yeah,
for me.
Take my shift.
I'll be leaving at 5.
Yeah, literally. Bye. Yeah.
You get 9 to 5.
Yeah, literally.
know.
That's so funny. Do you have any advice for anybody who's interested in becoming a nurse?
Just, I don't even know where to begin with that. It's a hard job. I truly think that like people don't recognize all that it is that nurses do. Like still to this day, I think that sometimes people don't realize, like I said, all day what we're dealing with, what the many hats we have to wear. So I just stick with it because truly it is such a rewarding job. I don't think I could have done anything else. I think I was really lucky in finding like my career at a young age and sticking with it. But it's a great, I love getting to touch people's lives in the way I have, and it takes a special person. So nursing school sucks. It does. It sucks. It's terrible. It's a miserable experience. Like my friends can tell you, I was probably not the most fun person to hang around, but stick with it because it's truly a great, great career. And the opportunity for like further education. If you're bored in one area, go to another one. Like it's endless. It's endless.
Awesome. Marissa, thank you so much for taking time out of your day and letting us know a little bit more about what nursing is.
Thanks, Steve. Thanks for having me.
Yes.
Let's eat some food.
Let's eat some food. And that concludes today's episode. If you enjoyed today's show, please give us a thumbs up. And if you didn't, please don't give us a thumbs down. Thank you for clocking in with us today. And thank you again, Marissa, for sharing your experiences as a nurse. If you have any questions about what it's like being a nurse, please leave them in the comments below. And lastly, let us know about what professions you want to hear about. Or if you have any funny work stories, we'd love to hear those too.